First, let me say how excited I am to hear from the Senate President himself that we will be getting the 1% for the 1% of budget for healthcare this year. This, I think, is wonderful news, and not only should we all be excited, I think we might all even go home right away, knowing that practically all our prayers have been answered. So I look forward. So we look forward to this budget, and I'm sure that in the next couple of days we will see it. Mr. Chairman, aside from lawyers, doctors are the next most important professionals. And why is that? As one rather rude fellow said, it is lawyers who usually cause people's medical problems. And of course, doctors benefit from treating them. Mr. President, that is, when I say Mr. President, I mean Mr. President of the Federal Republic and not Mr. also recognizes the place of lawyers. And that is why he appointed 7 lawyers into the federal cabinet. We are closely followed by doctors. 4 of them are in the cabinet. But you know, doctors, and I think this is to be expected, have a never say die approach to life. So when we thought we had won, we suddenly found a doctor sitting in the position of the president of the lawmakers. By that I mean, of course, the distinguished Senate President, Dr. Bukola Saraki. But we are comforted by the fact that he is now more a legal personality than a doctor. I trust that none of us will take our medical problems to him. It is a special privilege and pleasure to be here at the 58th Annual Delegates Meeting and Scientific Conference of the Nigerian Medical Association, the NMA. I'm here to represent President Muhammadu Buhari, and I bring his warm felicitations and best wishes for a very successful conference to you all. The theme of this year's conference, Quality Healthcare, an indicator of good governance, could not be more apt for these times. There has been, and I'm sure that we all appreciate this, a considerable amount of attention being paid in recent months especially to the importance of human capital development in Nigeria. And at the heart of this, of course, is to be found healthcare and education. A few weeks ago, we had a special expanded session of the National Economic Council, which I'm privileged to chair, on human capital development. It was an opportunity for frank and detailed conversations by government, civil society groups, and philanthropists, especially around healthcare and education. But two crucial takeaways from that meeting, at least for me, are first, is that while public sector investment in healthcare must be substantially improved, it is unlikely that it would ever be sufficient. In other words, paying for healthcare from budgets will not be enough to move the needle in healthcare funding. A robust national health insurance scheme will be required alongside private sector and donor partnership funding in order to truly move the needle in healthcare funding in Nigeria. The second is that these necessary investments and sacrifices in our healthcare system must be made in a timely manner and to demonstrate the patience and steadfastness required for the long-term planning and investment associated with enduring healthcare reform. These two takeaways, I think, are crucial from our extended meeting on human development in Nigeria. But it's no longer news that we inherited a troubled healthcare sector and that the healthcare sector has been troubled for a long time. As one of the manifestations of the severely low spending on infrastructure generally, and healthcare in particular, I think that what we've seen through the years is a scandalously low level of funding for public healthcare, for public health in Nigeria, and especially healthcare in particular. The levels of public sector investment in healthcare in our recent past has in no way reflected our earnings, or high oil earnings, especially in the periods between, say, 2010 and 2015. That was when we earned the highest in oil prices, we had the highest in oil prices. And to this, a devastating insurgency in the Northeast, which succeeded in bringing an already tottering healthcare system in that part of the country to its knees, with the attendant impact on immunization levels and the availability of medical personnel. There were some issues that consumed a substantial part of our attention, and these issues were amongst them. The problems with the healthcare sector, the problems of poor funding, and of course, the problems in the Northeast and the threats of the spread of diseases, some of those diseases that had been under control, on account of the fact that it was extremely difficult to reach many parts of the Northeast until a couple of years ago. I'm pleased to note that we have since stabilized this dire situation. Our short-term special intervention program and the medium-term economic recovery and growth plan have helped set the economy solidly on the path of recovery and growth. The insurgency in the Northeast has abated considerably, and just this week, for the first time, Borno State celebrated its first public May Day in Maiduguri in the past 5 years. Having identified healthcare reform as one of the major drivers of our nation's economy, and under the able leadership of the Honorable Minister of Health, Professor Isaac Adewale, our administration has prioritized basic healthcare delivery services for Nigerians through the revitalization of primary health care, and we have retooled the National Primary Healthcare Development Agency for better performance. President Buhari personally launched a pilot of this revitalization program at the Primary Healthcare Center in Kuchigoro village here in the FCT last year. And also in line with this, in 2016, we disbursed $1.5 million to each of Nigeria's 36 states and to the FCT to support them in strengthening their primary healthcare system as part of our Saving 1 Million Lives Performance for Results program. Another round of funding will surely be disbursed to performing states based on the results from an assessment of the impact of the first round of funding. Just last month, we launched, in the presence of the Director General of the WHO, the Basic Healthcare Provision Fund. The implementation of this fund will commence soon, and we expect this to be done in the 3 pilot states, Abia, Niger, and Osun states, with plans to scale up within the next year. In terms of public health, the proactive and commendable effort of the Federal Ministry of Health through the Nigeria Center for Disease Control, NCDC, in coordination with the national response to recent outbreaks of diseases, especially infectious diseases like Lassa fever, cholera, acute water, diarrhea, and cerebrospinal meningitis, is worthy of note. We expect that the passage of the NCDC Establishment Bill by the National Assembly will further strengthen the agency and provide smoother environment for their operations. Through the National Primary Healthcare Development Agency, we have launched an aggressive strategic plan to attain 80% immunization coverage by the year 2020. Because it is clear that we must improve the levels of immunization coverage in Nigeria. We have also, through our National Sovereign Investment Authority, invested $20 million in 3 of our tertiary hospitals, Lagos University Teaching Hospital, Aminu Kano Teaching Hospital, Kano, and the Federal Medical Center in Umuahia, Abia State, to establish world-class cancer treatment and medical diagnostic facilities. We intend to follow these with targeted interventions in the heart and in the treatment of heart and kidney disorders in particular. Again, in line with our overall economic development plans, we're working hard on incentivizing private sector investment in healthcare. Already, the CBN Hospital Intervention Fund has helped fund some hospitals, especially some of those that have shown track records for game-changing activity in healthcare. We believe that the next phase of healthcare development in Nigeria is going to depend a great deal on technology and innovation, which explains why we're paying a great deal of attention to the remarkable innovations of our burgeoning tech sector. Many young people are solving huge problems in medicine and in other aspects in other aspects of our lives with a great deal of creativity. In the medical sector, just a few days ago, I was talking about LifeBank, which is a company founded by a young Nigerian, Yemi, and Flying Doctors, another company founded by a young Nigerian, Ola Orekunrin. These two, both LifeBank and Flying Doctors, are startups using technology innovation to fill critical gaps in our healthcare industry. LifeBank works on blood shortage problems in hospitals, and they save lives by speeding up blood donations and delivery to hospitals in Lagos. Their LifeBank application, their app, connects donors and hospitals, and they ensure delivery of blood within 55 minutes. In the case of Ola Orekunrin's Flying Doctors, this is the first air-operated emergency medical service in West Africa. Her company provides air ambulance from a pool of 20 aircrafts and highly trained medical personnel for emergency evacuations. Recently, we ran a mechathon from our Northeast Humanitarian Technology Hub. Now, just to explain, the Northeast Humanitarian Technology Hub is one of the technology hubs that we're developing as a government. In the particular case of the Northeast Hub, it is to provide innovation in solving humanitarian problems that have arisen in the Northeast. And we've had hundreds of innovations proposing highly innovative solutions to public health problems. These are from very young Nigerians who are proposing some of these very groundbreaking public health solutions. We intend to engage even more robustly with our technology community on an ongoing basis because we believe that a lot of the answers to some of our public health problems will lie with the creativity of these young men and women. Our social investment program through our homegrown school feeding scheme is investing heavily in improving health outcomes for primary school children by tackling stunting and malnutrition. We're working closely with the Partnership for Child Development, PCD, a research body based at London's Imperial College, and with a track record of supporting interventions that translate into healthier and better educated children. The school feeding program currently serves about 7.6 million school children across 22 states and will continue to sign up more states practically every month. Although the school feeding program, as I said, does not cover all 36 states yet, and we're just in 22 states, it is very clear that this is a crucial program, especially in addressing the malnutrition needs of a large number of young Nigerians, of young children who are in deprived areas or who come from poor families. And through the Empower Youth Employment Scheme, we're expanding Nigeria's cadre of health extension workers who will make a positive difference in hundreds of communities across the country. We've engaged several thousands of them. I think we have about 40,000 of them who are engaged directly by government as part of our Empower program, and they're working as health extension workers in several local governments in Nigeria today. As I close, let me use this opportunity to express the deep concern of government about some of the negative impact that strikes in our public health service have. While agitations for better conditions of service by healthcare professionals are and will continue to be necessary and legitimate expressions, we also wish that medical personnel should take on some responsibility for showing greater understanding in your dealings, especially with government, as we jointly work together towards solving the several problems and tensions in the health sector. Many of these problems are problems that predate many of us in so many ways. Predate your administration, predate our administration. But there are problems that must be solved by sitting around a table and trying to resolve them. Where those problems, where the resolution results in the loss of lives of so many Nigerians, then we must take a second look at how to approach it. On our part, we will continue to listen to you and to discuss solutions that are agreeable to all stakeholders. We've constituted an interministerial committee to examine all previous reports, documents, policy instruments, and laws, including the Yayale Ahmed Committee report. With the goal of engendering cordial working relationships among all health personnel and between all of you and the federal government. I commend the outgoing national officers who have led the affairs of the association in the last 2 years, and a very impressive tenure devoid of acrimony and instability. I also must wish you very successful, rancor-free proceedings as you elect new officers. I'm always impressed by the excellent example of orderly elections and transition displayed by the Nigerian Medical Association. Please keep it up. But I must not fail to convey to you the sentiments of your compatriots of the legal profession, my profession. On this trend, your undisputed elections deprive us of very lucrative briefs, which we would have had were you to prefer the route of litigation. While not encouraging that course of conduct, I must remind you that whenever people pray on the 31st of December of every year, that may we not see litigations, some people do not say amen. It is now my singular privilege and honor to declare the 58th Annual Delegates Meeting and Scientific Conference of the Nigerian Medical Association, ABUJA 2018, open. Thank you.